In the field of health, technology is rapidly evolving with new advancements in areas such as artificial intelligence, robotics, and virtual reality showing great promise for improving healthcare. These technologies have the potential to diagnose, treat, and prevent diseases and to make healthcare more accessible and affordable. For example, artificial intelligence is already being used to analyze medical images and detect diseases, while virtual reality is being used to train doctors and surgeons. These technologies are changing the way we think about healthcare, and we can expect even more exciting development in the years to come. And to talk about this, I'm being joined live on the news by Bayode Thomas, Country Director, Instant Rad Nigeria, and Head of Radiography, Marigold Hospital and Critical Care Center. Glad to have you join me.
Hi, super excited to be here.
Amazing. Now, what are the biggest challenges facing healthcare in Nigeria?
Well, there's a lot of problems actually facing Nigeria. Well, not problems, because if you look at it relative to other countries, to be very honest, I think we're doing well, to be very honest, right, relative to, other African countries that we have. But however, some of the challenges that, we face is the fact that first, we don't have enough talent in the space. Right? We don't have enough talent in the healthcare space. We're not so advanced in the technologies that be in the global perspective. Now, so whatever conversation I'm having now is relative to what is tenable in the world globally, right? And because of the lack of the talent, there are over 200 million people in Nigeria, and we have just few healthcare professionals to cater for the healthcare of these people. That in itself can, pitch a lot of challenges, such, ranging from lack of preventive measures to our healthcare system in the first place. Because the truth is that healthcare is pretty expensive, very expensive. So which means that for us to not get to the point where we have to spend so much, we must be preventive conscious. But we don't have enough people to educate the people. We don't have enough people to even treat the people when they eventually, come with the diseases or whatever condition that they eventually have to come with. So the challenges range from different things: lack of resources, lack of manpower, lack of technology, lack of a whole lot of things that are in reduced number. However, we have super high intelligent people, but they are in their reduced number. So that will, cause a lot of problems in terms of making healthcare services accessible to a lot of people.
Now, of all those challenges you have mentioned, how do you think technology can help address some of them?
Prevention. So now with technology, we have a lot of technology, companies right now that are doing a lot in the telemedicine, aspect, in the teleradiology aspect, in the virtual reality, artificial intelligence, and all that. So now we can have technology platforms that can serve as advocacy, that can create advocacy programs that train people, that just educate the people to understand, when to go to the hospital. In Nigeria, where going to the hospital itself is like a prayer point. Anybody right now, like say in the hospital, like, wow, you're in the hospital. What? Like as if it's like a death sentence. But the truth is that it's not a death sentence. The problem starts from how people are even treated in the hospital. If we have the hospital, for instance, has an hospitality center where people just go to check themselves, and at the same time they are cared for and catered for. We have our government hospitals where you see where our nurses our nurses before now used to be known to be, wicked people that when you get there, they are like emotionless and the likes. But now we're seeing hospitals who are seeing their hospitals as an hospitality center where they genuinely care for patients. They're not even called patients anymore, they're now called clients, right? So if you look at that in itself has created that system where technology can now ride on and say, let's educate the people, let's be more prevention conscious, let people go for health check. It's a normal thing in the world. It's not a death sentence to be in the hospital. It's to be preventive conscious. When we're preventive conscious, we can arrest whatever problem the patient is going through at its early stage before having to get to the point where we have to go bankrupt because you have an illness. And the truth is that everybody is like a step away from bankruptcy with any medical condition.
Okay, let me follow up on what you said regarding the use of technology. What do you think are some of the risks associated with artificial intelligence, AI, like we like to call it?
Well, risk, we can't even start discussing risks when we've not even used artificial intelligence. The truth is that, in Africa in itself, when it comes to technology, Africa has not really, we've not done novel things, to be very honest. All we're doing is consuming what already exists. Look at the GPT-4 model. The GPT model of AI in itself are not situated in Africa, right? So we use the model, and then we cannot even start talking risk because we're using a model that we didn't develop. We're using a model that wasn't built by us, right? So what we should discuss now is to embrace technology.
Well, some say it may phase out the roles of certain people. What do you think about that?
Yes, definitely. The emergence of laptops phased out people who were using typewriters back then. Those who knew how to ride horses then had to submerge because of the rise of vehicles. So the truth is that evolution is constant. It's going to happen. Right. So, but what we're more conscious about is that our institutions now should start talking about the future, the emergence of what is to come in the future. Because the truth is that we cannot actually stop this evolution. It's going to happen, right? So, but it's going to phase out those who don't know how to use AI. It's not going to phase out medical professionals. Like for instance, now I lead country lead for Instant Rad. It's a teleradiology company that is meant to help doctors, report the medical images better. Right. The truth is that with time, AI models will be trained and these machines will be reporting the images by themselves. But the machines cannot make a report without the help of a doctor. So the doctor needs to know how to use AI for him not to be replaced. So it's not like AI is going to replace people per se, but when people know how to use AI, I mean, obviously, we can never take out human away from the healthcare space.
Now, as beautiful as this sounds, how do you think it can be made accessible for every level income earner in Nigeria?
And that's why, if you look at the tech space, the tech space actually, there are a lot of funding processes, and that's what is amazing compared to other business ventures that we have. The startup space now, we're getting a lot of traction from investors and people investing into technology, which means that people can now offer, like for instance, our platform, for instance, we can now offer our services at a very reduced price for those who don't have access to doctors. Now, but we must be preventive conscious. Technology will play little or no role when the problem is massive. But when we are preventive conscious, now we can access a doctor from anywhere in the world and talk to a doctor on whatever the condition or disease condition that you're going through are, right? And from there, technology can help. But we must be preventive conscious. Like everyone in Nigeria, we need to know that our health is very important. The only reason why you can do all you're doing is because you are healthy. And we must take that very important, and then technology can now help be that bedrock of the service delivery. Now,
talking about being cautious, what do you think are some of the ethical or even privacy concerns that may arise from the use of technologies like these, like you have mentioned?
Yeah, that's very important, because if you look at the space now, when you say technology, you are talking different things, including WhatsApp and some platforms that are probably not tailor-made. So we have to be conscious that our solutions are tailor-made to our healthcare system, especially in Nigeria, because we have a lot of people come in from outside the country to give us technology platforms that work for their system. Nigerian healthcare system is different. We have stratas of healthcare system. We have primary healthcare, we have secondary hospitals, we have tertiary hospitals, you have private hospitals. Even in private hospitals, there are different systems. Now, what we should be more focused on is that first, we are NDPR compliant, which is like the regulatory body for privacy, data privacy, regulatory body for Nigeria. And from there, we can now tailor our solutions to the individual facilities that exist, the structures in the individual facilities. Not just bring a technology into Nigeria and expecting it to work in a last route, for instance. Last route is super robust. So if you're going to build a platform for last route, for instance, you're going to build something that is tailor-made for what can work for the system, for so last route, and it's kind of facility like that.
And that's a fine place to wrap it up. Thank you for your time on the news. Bayode Thomas, Country Director, Instant Rad Nigeria. Thank you once again.
Thank you so much. It's a pleasure.